Health workers in eastern Congo can cure Ebola, but they can't stop it from coming back every few years, because the virus isn't the real problem. This is the 17th Ebola outbreak in the Democratic Republic of Congo since 1976. 17 times, the same country has watched the same horror unfold: fever, bleeding, entire families wiped out. And this time, in Ituri province, it took weeks before anyone even knew Ebola had returned. Early surveillance systems failed to identify the rare Bundibugyo strain spreading through villages. By the time the World Health Organization declared an international emergency on May 17, at least 136 people were already dead and over 500 cases had been reported. The disease didn't spread undetected because Congo lacks medical knowledge. It was discovered here in 1976, named after the Ebola River. It spread because over 100,000 people were newly displaced by armed conflict in the weeks before the outbreak was confirmed. When fighting erupts between militias and government forces, families flee into the forest. They can't reach clinics. Health workers can't reach them. The surveillance network that's supposed to catch the first case and stop transmission before it becomes an epidemic simply collapses. Eastern Congo has been locked in this cycle for decades. More than 5.7 million people are displaced across the country, the largest displacement crisis in Africa. In Ituri and North Kivu provinces, where this outbreak is centered, armed groups control territory, loot hospitals, and make it impossible to maintain the basic infrastructure that epidemic response depends on. Contact tracing requires visiting every person an infected individual touched. Vaccination requires cold chain storage and community trust. Isolation requires facilities that haven't been destroyed or abandoned. None of that exists when a region is at war. What makes this outbreak particularly dangerous is that health officials were playing catch-up from the start. The Bundibugyo strain had only caused 2 previous outbreaks, one in Uganda in 2007, one in DRC in 2012, and existing rapid tests weren't designed to detect it. Samples had to be sent to a laboratory in Kinshasa, the capital, hundreds of miles away. By the time results came back confirming Ebola, the virus had already spread across multiple health zones in one of the most densely populated conflict regions in Central Africa. The WHO Director General said he was deeply concerned about the scale and speed of transmission. But speed is what happens when you combine a lethal pathogen with a population that's been running from violence for years. Displaced people live in makeshift camps with no sanitation. They move constantly, carrying infections across borders. Cases have now been confirmed in Uganda. And because the conflict has destroyed trust in authorities, many communities initially resisted health workers, fearing they were aligned with one armed faction or another. There are treatments now. There are vaccines in development. Congo's health ministry has experience managing Ebola. They've done it 16 times before. But none of that addresses the reason the 17th outbreak happened, or why there will be an 18th. As long as Eastern Congo remains a war zone, Ebola will keep finding gaps in the surveillance system, spreading through displaced populations who can't access care, and killing people who never had a chance to be protected. The virus isn't the problem that needs solving. It's everything that allows the virus to spread undetected for weeks in a region that's been fighting the same disease for nearly 50 years.